I see a lot of good things out of this bill, and it's probably something that's long overdue to stimulate the conversation with these HMOs and the providers, because over recent years, they've taken the driver's seat on the delivery of health care. They're dictating to the medical profession how they're going to treat a patient, what tests they're going to order, and what medications they're going to prescribe. Most recently, I've received numerous calls from constituents, especially those in the diabetic situation. I've had one that's a childhood diabetic who's now 55 years old, insulin diabetic for all his life, and his HMO, by the way, Empire, provided by the state of New York, turns around and says, we're no longer going to let you take this medication. We want you to take this type of medication. His doctor vehemently opposes it. His specialist vehemently opposes it because the formulary is different, and they will not accept the request from these doctors and insist he has to change his medication. And when you look behind the scenes, it's the coordinated effort they have with the providers of this alternate medication, as pointed out before, they get the better price for. And they think, in their best wisdom, that this is the better prescription to use, not knowing the man's entire medical history, the fact that he's legally blind, the fact that he has substantial other medical problems, and why this medication they're suggesting he takes is not right for him. So while this may not cure all the ills that we have right now going on with the industry for medical insurance, it starts the conversation. It puts them on notice that the legislature is paying attention to them, because what happens with many of these companies, and I understood what my colleague Mr. Cahill indicated before, and to some sense he's right. But many of these companies, it is profit motivated. It is getting the most out of their dollar they can, notwithstanding what the patient needs. Has there been abuse by providers in the past? Sure there has. But generally providers work very honestly to provide quality medical care that's needed for their patients. But these insurance companies collect their premiums and don't want to pay out when they have to. And the stories on Long Island that we get, and as well as many of my colleagues may hear throughout the state, are consistent. There's a deprivation of medical care. The insurance carriers are substituting their judgment for that of the medical practitioner who's treated the patient, knows the patient's history. Of course, many of them have nurses on staff and doctors on staff that make these judgment calls to cover them. But these people are still not seeing the patients. They still don't see the patient's history. They should not be able to make these types of calls. And it also affects the way they negotiate their price schemes with these providers. It's just almost akin to price fixing of what they do. So if anything, I applaud this piece of legislation. Again, it doesn't fix everything, but it's the starting point. And contrary to the other requests that have been made today, I would encourage our colleagues here in the House to vote in the affirmative for this bill, as I will. Thank you.